This is Justin. We're going to finish with the abdominal assessment and the musculoskeletal assessment. You want to do this assessment with the patient lying down, and normally your patient would have a gown on, so you would be able to visualize their skin and everything, but for this assessment we're just going to do it this way. You want to auscultate first you want to look for any abnormalities, any herniations or any skin lesions or anything. Next, you would want to listen. You want to listen with your stethoscope using the diaphragm. You want to start in the right lower quadrant and listen for bowel sounds in all four quadrants. And you're listening for hypoactive, or absent bowel sounds, and Liz's bowel sounds appear to be within normal limits. Next, you want to auscultate using the diaphragm, the bell. And what you want to do is you want to start at the right of the umbilicus, and then move to above the umbilicus to auscultate the renal artery, and listen for a bruit or a thrill. And there's no bruits noted. That would be a whooshing abnormal sound. Next you want to palpate. And by palpating, you want to start lightly in the right lower quadrant, and you want to just kind of lightly palpate your patient, as you don't want to hurt them. You next want to palpate the spleen, and by doing that you have the patient taking a deep breath and let it out, and then you just, okay, good, alright. Next you want to palpate for the liver. So, I'm unable to feel that, which if you can palpate the liver, that's a sign of some liver damage like cirrhosis or hepatitis or abnormal finding like that. Next you want to percuss, and you want to percuss listening to the sounds, and the sounds are, you'll hear a dull sound if you're over an organ, or a tympanic sound if you're over a fluid or air-filled space. And if the bladder is full, it will sound dull, and if there's a bunch of stool in the intestines, it will sound dull sounding also. Next, we're going to finish with moving to the musculoskeletal. And for this assessment, we're going to check the alignments of the hips, and her hips appear to be aligned okay. Would you cross your feet, please? Thank you. Next, we're going to check for hip dysplasia or problems, and we check that by feeling and listening for clicking sounds of the hip, and I did not feel or note anything. This concludes our assessment. Do you have any questions? All right, thank you.